Complete Bay Area news coverage starts right now. This is the 10 o'clock news on KTVU Channel 2.
Good evening. I'm Julie Hayner.
And I'm Frank Somerville.
Nurses at 5 University of California medical centers say they're ready to walk off the job. The labor dispute centers on what the nurses call an alarming decline in safe staffing levels. KTVU's Amber Lee is in San Francisco with the latest on when a strike might take place. Amber.
Julie, over the weekend, nurses at 5 University of California hospitals, including UCSF here on Parnassus, voted to authorize a strike. They tell us it's not about salaries, but patient care.
We are moving at a very fast pace, and that's my fear, is that we're going to make a mistake and that patients aren't getting the care they need in a timely manner. You know, patients call for help, and they want a nurse right there. They don't want to wait a half an hour.
Maureen Dugan and other UCSF nurses tell us this summer the hospital cut the number of nurses during each shift. That means at times nurses work a 12-hour shift with no breaks and take on more patients.
It's very frustrating when there are impediments to me taking care of my patients the way they deserve and need to be taken care of.
State law requires hospitals to have the ratio of 1 nurse per 5 patients. The ratio could be lower depending on how sick the patients are, such as those in ICU. But some nurses are alleging that UC is violating the law, for example, by placing ICU patients in other units where nurses have to care for more patients.
We absolutely comply with the state law. The second thing I would say is UC medical centers are known nationwide, if not worldwide, for outstanding patient care, and we don't get that reputation with lax staffing levels.
UC says staffing levels should be resolved at each individual hospital between the managers and the nurses.
We agree it's a key issue. We, I think, just disagree in terms of how it should be addressed. Our view is that it should be addressed locally in each hospital.
Tonight, we caught up with Raul Diaz as he arrived at the hospital to visit his nephew, who was recently paralyzed in a car accident. He told us he's noticed how overworked the nurses are.
The response to my nephew when he makes a request is not as quick as it could be, and we know they are understaffed.
The level of care that we have given has constantly increased, and the amount of tasks that nurses have to do have constantly increased, but UC has adjusted staffing for that.
The nurses' union has not yet set a date for a strike date. Both UC and the union hope to resume negotiations after the holidays. There has never been a nurses' strike at UC hospitals. Reporting live here in San Francisco, Amber Lee, KTVU, Channel 2 News.